This episode is brought to you by my very first book, The Fifth Vital Sign: Master Your Cycles and Optimize Your Fertility. With over 1,000 research citations, it is the most comprehensive resource on fertility awareness and the menstrual cycle to date. The Fifth Vital Sign is available in paperback, ebook, and audiobook formats on Amazon.com. Listen to The Fifth Vital Sign for free when you sign up for a 30-day trial with Audible. Visit fertilityfriday.com/audible for details. That's fertilityfriday.com/audible. This episode is brought to you by my free 3-part video series, FAM 101. Discover how to chart your cycles by tracking the 3 main fertile signs: cervical mucus, basal body temperature, and cervical position, and ultimately develop body literacy by paying attention to your fertile signs. Head over to fertilityfriday.com/FAM101 to grab your free copy. That's fertilityfriday.com/FAM101. This is the Fertility Friday podcast, episode number 259. Welcome to the 259th episode of the Fertility Friday podcast. Thank you for joining me today. I'm Lisa from fertilityfriday.com, and this is your source for information about the fertility awareness method and all things fertility. Okay, I know I say this every time, like literally every time I release a new episode, I tell you how excited I am to share it with you. But it's actually true because, over the years, I've had so many great guests and episodes for you. And today is no different. In today's episode, I'm sharing an interview with Dr. Aviva Romm. And, this episode, I found it to be so powerful. I had to go back and listen to it a couple of times after our initial recording. What I loved about the conversation that we had together is we really dove into, modern medicine and that disconnect between the way modern medicine addresses women's health issues and what it is that women really need, in order to achieve optimal health. And Dr. Romm's experience is unique because not only is she a medical doctor, but she worked as a midwife for 20 years prior to going to medical school. And so through our interview, you'll hear how her experience coming into medicine with this experience in, a holistic, woman-centered profession has guided and informed her practice. And even the struggle of reconciling that experience with the reality of medical school and the medical profession. So I know you're going to appreciate this episode as much as I did. So without further ado, let's jump into my interview with Dr. Aviva Romm. And I'm very excited to welcome my guest, Dr. Aviva Romm, to the show today. Dr. Romm is a midwife, herbalist, and Yale-trained MD, board-certified in family medicine with Obstetrics, who has been bridging the best of traditional medicine with good science for over 3 decades. She is considered one of the world's leaders in botanical medicine and is the author of 7 books on natural medicine, including the textbook of Botanical Medicine for Women's Health and the Adrenal Thyroid Revolution, which we'll be talking about today. And so in today's episode, we'll be delving into thyroid and adrenal health and how it can impact fertility and the menstrual cycle. So without further ado, welcome to the show, Aviva.
Thank you, Lisa. It's so nice to be here.
Well, thank you for being with me here today. As I was mentioning, I'm really excited to chat with you. I had an opportunity to read your book. The listeners can't see me holding it, but the Adrenal Thyroid Revolution.
I see you holding it. She's telling the truth.
And before we jump into it, as you know, I've got dozens of questions for you. But before we jump into it, I'm really interested in the story of, I suppose, what brought you into medicine, but in particular, your experience and practice that drove you to focus more on thyroid and adrenals.
Yeah, so a very long story brought me into medicine. It started out with scientific curiosity, actually, as a kid, and then culminated in leaving home really early to go to college. I was actually 15 when I went to college, meeting with a midwife, learning about the history and politics of medicine and women's medicine. That was back in the very early, it was like 1981. And subsequently, that inspired me to become a midwife and women's focused herbalist. But there were a lot of reasons that I felt like women's health and women particularly were falling through the cracks in conventional medicine. And that's really a polite way to put it. I mean, falling through the cracks is sort of the mild end of the spectrum. I would say more often than not, women's sense of their own bodies was being denied. They were being told that real physical medical conditions were in their heads. And when I say in their heads, I don't mean in their hypothalamus or pituitary. I mean their imagination. And to the extent that women's serious medical problems were being missed, ignored, and dismissed, and women leaving medical office after medical office completely discouraged. And I've even seen some things that were outright abusive happen. So I, in my 30s, actually circled back around to the path of becoming a physician and went to med school. I went to Yale for my medical training and Yale for my internship in internal medicine, and Tufts for my residency in family medicine, where I also specialized in integrative medicine, women's health, and and obstetrics. And when I got into my clinical practice, now, of course, I'd been in clinical practice for 20-something years before med school, and then, now after med school, so it's been about 35 years altogether of clinical practice, I continued to see the same phenomenon, women being missed, having diagnoses missed, and being dismissed. And sometimes these were pretty serious things. So, for example, we know on average it takes about 9 years for a woman to get a diagnosis of endometriosis, even though she might be living in and telling doctor after doctor she's in extreme pain. We know that for women with autoimmune disease, it can take up to 5 years and 5 doctors before getting a diagnosis. And Hashimoto's is definitely one of those autoimmune diseases that can have serious consequences for women when it's not treated, including, your specialty area, fertility, and of course, period problems and other hormonal problems, but can also cause devastating depression and brain fog. And so I was having woman after woman come into my office, having seen many other medical doctors who had sometimes said dismissive things, sometimes said horrible things. I had one woman who had gained like 30 pounds in 6 months, and she turned out to actually have Hashimoto's on conventional laboratory testing. The previous doctor she had seen told her that if she had just controlled her fork to her mouth, she'd lose the weight. I mean, who says that to someone, right? And so I was seeing a greater and greater prevalence in my practice of women who were fatigued, experiencing brain fog, hormonal problems, weight gain that they just couldn't explain, a whole host of depression, a whole host of symptoms that could be kind of dialed back when you look at the roots of it to much more core problems like dysfunction in the stress response system, which we kind of encapsulate by saying the adrenals, but it's much more than that, or the thyroid. So I've increasingly brought my attention to those areas, although I do work with women basically across the board in whatever they're experiencing, with a big focus on hormones. And of course, adrenal hormone is cortisol, and thyroid hormones play a really central role in all of this.
Mm-hmm. Well, thank you for taking us through that. One of the things that struck me, so towards the beginning of the book, you were talking a little bit about what your experience was in medical school. And I love it because you kind of called it out. You kind of outlined basically where is this disconnect. And whenever I have an opportunity to speak to a doctor, I'm always really curious just to find out about what the experience is like in medical school. Maybe shed some light for us about what your experience was about how women's health issues, and I suppose we could also say chronic illness, was addressed, in medical school, and how now, given your experience and your years of practice, how you can kind of reflect back on that and help us understand why these issues continually are being missed essentially in women.
Yeah. So, I mean, the bottom line is it really wasn't addressed. So we were taught, names of diagnoses for most of the conditions that a person can, end up with as a human being. But there was very little emphasis. And bear in mind, my specialty area is gynecology and obstetrics. I'm a family doctor, but my specialty is in women's health. And when I was in my medical training and my first year of my residency at Yale, it was such a dire absence of women's health that I actually went to the department director of internal medicine and asked if I could create a new department in women's health internal medicine. and was actually granted permission to do that because there was such a lack of focus on it. So I honestly cannot recall ever having any education whatsoever about endometriosis, PCOS, nothing about fertility beyond reproductive medicine and fertility treatment and testing. Really, when it came to the thyroid, we had extensive endocrinology training, both in my undergraduate medical training and in my residency. But it was really much more like check your TSH, which is sort of the main thyroid hormone or the main thyroid stimulator. Check TSH. If it's normal, everything's fine. Boom, move on. If it's not normal, use Synthroid, which is the main standard medication. You know, give the dose. Boom, move on. I mean, it was really quite skimpy and almost embarrassing when I think back on medicine and how absent women are from it. And, you know, I wrote an article called How Being a Good Girl Can Be Hazardous to Your Health. It's a blog on my website, which would be really relevant for listeners to read because it talks about a couple of experiences where I was actually dismissed. And I think it was partly being a woman doctor over two patients who were women patients who were experiencing, one was experiencing pain and one was experiencing some mild symptoms, but they were really abnormal for that woman. And what the consequences of that dismissal of pain were for the first woman, and how I basically ended up having kind of like a jumping up and down fit, insisting on getting care for the second woman after the first woman actually died of lack of being listened to. Not by me, but by the attending doctor who just basically kept saying, oh, this is nothing, this is nothing. So for me, looking back on it, it's really sad to see how absent women's health is. We learn all the basic stuff, like we learn, you know, how to get birth control. We learn how to put in an IUD. We learn how to diagnose a pregnancy, how to do prenatal care if you specialize in obstetrics. But everything else is sort of name it and tame it is what I say. You know, you name it, you find the diagnosis that best fits, and you give the drug or surgery that is appropriate. And there is a tremendous history in medicine of dismissing women. So hysteria is a medical diagnosis that existed in the medical diagnosis, like you could find this diagnosis well into the 20th century. And basically anytime a woman had pain, depression, anxiety, but also anything to do with sexual dysfunction issues, pelvic pain, period problems, she was given this label, hysteria. And ironically, the word hysteria comes from the Greek word hysterikos, which means a uterus. And it was used as a way to dismiss us as having basically all of our symptoms were psychological problems. And pretty much everything that women had been historically dismissed for, even 75 or 100 years ago, we now know is a formal diagnosis. But still, like the statistics on endometriosis, for example, show both in the US and in England, the UK, that 70% of doctors have no idea how to diagnose it. 70% of primary care doctors. So we're not talking about like a cardiologist. We're talking about the doctors who are out front seeing women day to day, have no idea how to diagnose it. And even if they do know how to find out how to diagnose it, they have no idea how to really treat it. And everything is kind of just basically medicalized and pharmacologically treated. There's no exploration of what we actually know to be good medicine, which is looking at what's called the exposome, like looking at all the factors internally and externally that lead to these problems. So let's say a woman has trouble getting pregnant. Maybe she's 36 and she's been trying to get pregnant for 6 months. Well, let's say she's not even 36. Let's say she's 34, because at 6 months, maybe it would be appropriate to do a workup. But let's say she's 34. She's been trying to get pregnant for 6 months. She's just come off of birth control pills 2 months prior, and she's not getting pregnant. Like, I've had so many women in my practice who have said they've already been referred for a fertility workup rather than, well, it could take a little longer to get pregnant. Maybe it has something to do with that your hormones are still dysregulated because you were on the pill, or 50% of women who go on the pill go on it not for birth control, but because they had some hormonal imbalance. So let's look at what that was. But no, instead it's just like, let's get you onto the conveyor belt the assembly line. I jokingly call it, it's not really funny, but the disassembly line of fertility treatment or whatever it might be. So it's really frustrating.
Well, I really appreciate you sharing with us, because you are a medical doctor. You did go through medical school. And I think the most challenging part, because it really does feel like we're in the midst of a women's health revolution here. And so as we go through this, a lot of women are being educated and demanding more, but feeling very frustrated because we're still going to our doctors who were still trained within the system. And many women find that, they're looking for answers and really wishing that their doctor would have all of these answers for them. But I feel like just how you took us through all of that, it helps us to understand and even have some empathy for doctors, but to really understand that just the way that they were trained and how that factors into the type of treatment that they get. And
most doctors who go into, practicing medicine really do care about patients and really have high standards. The problems are deeper than the practitioner. The problems are, one, medicine is asking the wrong questions. It's not asking what's really going on that's causing these diseases on a systemic level. It's more looking at let's get sort of reductionist and only look at genes and bugs, and it's really missing the bigger picture. And so there's lack of asking the right questions, lack of understanding that root causes really do cause chronic and acute health problems. And also there's a tremendous influence of interests that are not in the best interest of the patient or the individual, or in the interest of the practitioner for that matter, at play. So insurance and bottom lines that are causing doctors to have to see sometimes 40 patients a day. I'm not kidding. I mean, it's brutal. And a pharmacology or pharmaceutical, I should say, pharmaceutical industry and surgical industries, especially surgical device industries, that create tremendous fuel in terms of medical journal articles or things that aren't based on the best evidence, that then give busy practitioners who maybe don't have time to go deeper and expect that what they read in their medical journal to be true, the wrong information. And, it sounds so conspiratorial, but actually, the evidence for all of this is there. There are there's article after article after article on how pharma and industry influence the practice of medicine, how the medical model is based on a profit motive, and that keeps the patient from getting what she needs. And again, just looking at things completely missing the fact that, socioeconomic status, access to good food, and then even if you have access, eating the right food, stress, environmental toxins, all of these things have a very real impact. And it's measured. All of this has been measured, but it's not really significantly influencing the way medical practice is done right now.
Mm-hmm. Well, I'm curious now, because you went through this training, you went into practice, you were working with patients, and obviously at some point realized, okay, A plus B is not equaling C here. Women deserve better. And so how did you then switch your focus and increase your education? How did you make up for what was lacking in your initial training?
Well, I had kind of an unusual background in that I had been a midwife and an herbalist for over 20 years when I went to medical school. So I was already teaching at medical conferences. I had already was in the process of writing a women's medical textbook. I was on scientific advisory committees. So I actually became the creator of or co-founder. I worked with two other people that I brought into the process of the integrative medicine program at Yale. So when I got there, it was kind of a great time in the sense that integrative medicine had sort of come out of the closet. People were excited about it and interested about it, but still really skeptical. And I have this ability to kind of be a chameleon, and I'm able to communicate in a language that is disarming for my medical colleagues. I mean, I understand what standards they're looking for. I understand what kind of information they need to hear to feel safe applying something or trusting something. So I kind of came into medical training like I was a guest in someone else's house, really respectfully, seeking to learn what I was missing, but also became very well regarded for what I brought to the table. So when I got out of medical training, it was a pretty natural marriage for me already. You know, as I was going through my medical training, there were really exciting eureka moments of, wow, so this is really why that herb does that. Or, okay, so this is the pharmacology, or this is the biochemistry, or this is the physiology behind what we're all talking about. And that made it really fun. And it was a fabulous way to amplify my message to other medical professionals. I think the biggest thing for me coming out, Lisa, wasn't so much how to do what I do, but there were some insidious behavioral shifts or psychological shifts that I felt like I had to unwind from after. There were parts of me that I felt like I could pretty much bring my whole self to the table, but there were parts of me that I sort of kept quiet because it just didn't really fit into that environment. Like I say, you know, if you go into, let's say, a Muslim country and you're a woman, out of respect, you might wear a head cover, or, you know, you might just change the way you appear or carry yourself, change the common language you use to be respectful. But if you're there long enough, after a while, when you come out, you kind of have to get comfortable back with who you were before. And so there was some of that. There was some of that letting go of some fitting in, and just a certain amount of fatigue. You know, the system it's a system that really breaks and beats people down. And a lot of similarities to when people who have been on a military tour can relate to each other because they've been through something that only they can understand. Going through medical training, certainly it's not being in Iraq or something, you know, like that, but you lose a tremendous amount of sleep. There is a lot of personal deprivation, a lot of stress and responsibility. And in spite of there being many more women in the system, it's still an old boy patriarchy in the way the system is. So people talk down to each other. There's a lot of belittling of people. And even if you're not experiencing it, you're seeing it happen. So, you know, like we know that, for example, bullying has a tremendous psychological impact on people who have been bullied, but also it can have an impact on people who watch bullying and aren't able to safely do something about it. And it's a very bullying system. So I think a lot of doctors who come out of that system, you know, I fortunately went into it with a very deep women's spirituality, a very deep practice, a deep connection to the earth, a deep connection to my roots in women's health, and philosophies that carried me through, and friends who supported me to stay intact with who I am. But a lot of these people who go into medicine, they have been in college, they have been in school since they were in kindergarten, and they go straight through, and it's a very suppressive system. So when you're dealing with a doctor in practice, not only have they not learned what you need them to have learned, but they're often really exhausted, really stressed out, really burdened, you know, constantly under the threat of a lawsuit. And it doesn't make for good interpersonal communication all the time.
Yeah.
Yeah.
I feel
it's a
like
complicated system I think it's part of why women aren't getting what we need when we go into the doctor's office. There's so many factors going on.
That was a really interesting window into it. I really appreciate your perspective. That it just makes a lot of sense, and obviously sounds the exact opposite of health. So going through the system that basically encourages you to do the exact opposite of everything that you describe in your book. It's
so true. I was talking to my husband about this yesterday. So I got into natural healing when I was 15, and I did not take an antibiotic for almost 30 years. Never once. And I still haven't, except for one time in medical school. I got really sick. I got a kidney infection, and I realized it was because I wasn't drinking enough water because I didn't have enough time to pee. And when I say that, I'm not kidding. And then I started getting sick, but I couldn't take time off because my residency director wouldn't give me time off. And I ended up really sick, like almost going to the hospital for IVs, but I didn't, and had to take 10 days of an antibiotic. And it was like a complete disconnect from the rest of my life and the health of the rest of my life. I mean, fortunately, I ate well, you know, I took good care of my spirit, but you can't compensate for lack of sleep and like lack of going to the bathroom and hydrating.
Well, yeah, no, that I think that a lot of the listeners are going to sit with what you just described, even the bullying piece of it, because obviously patients are bullied into a lot of things from time to time, whether it's procedures that maybe they're not ready for, that they wish they could have a week to think about, but they're told they need to do it today, or you know, not being believed and all of that. And especially that's compounded as women. So this is really
I think
valuable.
It beats the softness. It really beats the softness, or it tries to beat the softness out of people. I can remember just, you know, one quick story. I had a patient when I was on one of my obstetrics rotations. I was on a high-risk obstetrics rotation. And it was a woman who had had 3 previous C-sections. And having C-sections increases your risk of a placental problem called placenta accreta, where the placenta actually embeds too far into the uterine lining, so it won't separate after the birth. So you have to have it surgically removed. So here she is in her 4th pregnancy, and hers was bleeding. So she had to be in the hospital for 3 months. Her kids and her husband would come visit every day after school, but she was really stressed and really worried about hemorrhaging and worried about losing the baby. So every morning I would see all my 9 other patients, you know, between like 6 and 7 in the morning. And then I would save her my 10th patient for last before morning rounds, and I'd spend a little more time with her. And I walked out of her room one day, and one of the doctors, who was my supervisor, said, I'll never forget this. He said, "Dr. Romm, if you're ever going to be a good doctor, you need to spend less time talking with your patients." And I just remember like checking off this imaginary box. Well, I guess good doctor is coming off my list, if that's what it means, you know?
Wow. Yeah. Oh my goodness. Yeah. There's so much value in everything that you just told us. Like one of the biggest challenges I feel like women face in this day and age is getting adequate care. But I think that part of it is really understanding. It's not to put, it's what you said. It's deeper than an individual practitioner to practitioner basis. But first and foremost, we really have to appreciate the philosophy, the training, where people are coming from, and understand how that's going to affect their outlook on our care.
Exactly.
And even their outlook on what's possible.
Like none of us as women, and nobody who's sick, should ever have to go into a doctor's office, an emergency room, a hospital room, having to manage the emotions or stress of their provider, right? The provider should be doing that and should only be there to help you. But the reality is that women, and there's some really good studies on this, women who have chronic health problems, chronic symptoms, particularly pain, or anything that requires them to go to doctor after doctor and not get an answer. So anything to do with fatigue, pain, vague symptoms, but also things like PCOS, endometriosis, fertility, thyroid, all of that fits into that kind of constellation of these types of things. We know, interestingly, that those women are more likely to get passed from one doctor to another, or they go from one doctor to another. And each time they go to the next doctor is more likely to think that the problem is in their head, because we're taught to look out for the psychological patient, which is the one who hops from doctor to doctor, not thinking, well, maybe she's just not getting a diagnosis. And then we know that women who don't get a diagnosis have to become more aggressive with each practitioner to be heard and convince that doctor that they really have a symptom or a situation going on. And so you've got this exhausted, irritated doctor who's looking at you like you're a psych case, and you've got this woman who's getting more and more and more irritated. And it's like a recipe for a miss. It's like if you imagine that in your primary relationship, you and your partner would probably end up in some kind of complete fight or disagreement, right? Yeah. And so this is part of what's happening. And so none of us should ever have to manage our doctors, but knowing some of this can help you approach your medical appointments with an attitude of trying to what's called get to yes, right? So it's like understanding where they're coming from and being heard in a way that gets you what you need in the end. It's awful that it's like that, but until it changes, and for some doctors it is changing, but it's still kind of like that in a lot of the systems.
Mm-hmm. It's so interesting. I mean, I'm sure you can think of a lot of examples. I'm always talking about the menstrual cycle. So what comes to mind for me is like, well, if you're concerned about something that you're seeing, just use the word discharge. Like, ha ha ha, right? Because that's the magical term that you're speaking their language. And I've heard so many examples of that over the years, as I'm sure you can imagine. You have to ask for this specific thing. As women, it's helpful to have just a specific set of guidelines so that you can try to get to the point and speak in their language and also appreciate what they can and can't do. That's one of the things I'm always talking about, what they can and can't do. You can't go to your doctor and ask for a detailed nutritional plan.
Right. It's like with that expression about you can't go to the hardware store and expect to get milk and then and then get mad when you don't get milk. Yeah. I can tell you from 7 years of medical training at top institutions that we had 1 hour of nutrition training, 1 hour in 7 years.
That's not even possible.
That includes medical school residency. Yeah.
Wow. Well, let's talk about some of the reasons that women are finding themselves in your office. One of the topics I wanted to talk about a bit today is, of course, the connection between adrenal and thyroid. I know it's a really big topic, but I wanted just to get into it a little bit because I think addressed it on the podcast a couple of times. I mean, adrenals, it's kind of a little bit vague for many of us. We hear the word a lot, but maybe shed some light on it and share with us just the connection between this whole issue with adrenals, but also stress management, cortisol, just how, paint us a picture of how this is causing us to end up in your office and not be listened to apparently by our doctors.
So the adrenals are two tiny glands, which means they secrete hormones and chemicals that sit one on top of each of the kidneys. And I think we use the adrenals as kind of a catch-all term for what we're really talking about, which is fatigue, brain fog. This is kind of like a low motivation, low drive, getting sick a lot, having a lot of kind of just sort of general body symptoms. And we know that it has something to do with stress. So think about the adrenals as sort of the end point and delivery system in the stress response. But the stress response actually starts in the brain. It starts in these two little organs in the brain called the amygdala. And those are like a surveillance camera, if you will. And they're looking for danger outside of you, and they're looking for danger inside of you. So danger outside of you can be like literally you see somebody walking around your apartment at night that shouldn't be outside your apartment window. Like a danger like, that's not right, and your brain registers it. It could be somebody, for example, that reminds you of somebody from your past that you had experienced some trauma or discomfort with. So it could be maybe that person from your childhood wore a rose-scented perfume or a cologne, and now you're at a concert and you smell that and you go into panic. You just feel something wash over you. So it can be anything that's like a perceived danger. PTSD registers in this part of the brain. And then it also registers internal discomfort, so hunger or memories of things that can trigger it. And that surveillance system, if it picks up, it's like an alarm, and it picks up this danger, it sends a message to the central gland in your brain called the hypothalamus. The hypothalamus then sends, so think about the hypothalamus as calling 911, right? The amygdala picks up on the surveillance camera, and then like the security system gets activated and 911 gets a call. 911 then sends a message to, let's say, the adrenals, which would be like the fire department and the police department and the ambulance service. So the adrenals act like all of that. So think about it this way. The fire department is where cortisol comes in. Cortisol's job is to put out inflammation, but it does a lot of other things. It controls your blood sugar, your blood pressure. It controls your the way your brain works, whether you're in danger or hypervigilance or whether you're calm. It controls the adrenals, control adrenaline. They produce adrenaline. I think about adrenaline as the police department. Like they're going to be in automatic, crowd control, like moving fast. really able to rapid respond to something that's not right. It gets you in that like super on guard mode. And then the ambulance service is partly the cortisol as well, because as I said, it maintains your blood pressure. So if you were to get injured and bleed a lot, you could go into shock. Think about the cortisol as acting like the ambulance. It's going to give you fluids to keep your blood circulation up enough so that you don't go into shock. And so what the whole system is intended to do is keep you alive in danger. And what the problem is that traditionally, or in more primitive times, danger was more the exception than the rule. I mean, life in general was probably more dangerous, but in the sense that you weren't constantly worrying about the next bill coming in. You weren't living isolated. You weren't dealing with a world where people go into churches and mosques and synagogues and schools and shoot people. Like, there's all these little insidious stresses that we have 24/7 that keep that system activated. That system also gets activated when you're under any kind of stress or that your body or brain perceives as a threat. So low blood sugar, for example, activates your primitive responses, telling your brain that it needs sugar. And if it doesn't get sugar, you're going to die. Like, it's that serious. Your brain needs sugar to function. So low blood sugar acts as an alarm system that gets that system activated. But interestingly, also anything that causes inflammation, so chronic underlying viral infections, environmental toxins, a high sugar, high poor quality fat, low good quality fat diet. So basically modern life keeps that stress system constantly activated, or at least chronically activated. It may quiet down a little bit while you sleep, or if you meditate or do yoga or get in the zone, just like dancing it out or doing art or journaling, those things calm it down. But the general is like we're highly set to be super activated. And what happens is when you go into survival mode, your brain tells your body that it has to be conserving energy. It has to shut down unnecessary functions that might tax you too much. And so things like weight gain happen because your body thinks, well, where's the famine? I better save all this energy and pack it around her waist, which is a great storage place in case there's a famine. Or, yeah, something's going on in the environment and she's exhausted, or she's not getting the nutrients she needs, or something is frightening her because this is just not a safe place. So this is probably not the best time for her to reproduce. So we're going to go ahead and we're going to make her thyroid and we're going to make her ovaries go on low function mode. And so we start to see things like hypothyroidism and not ovulating and having wonky periods and fertility problems. And over time, it gets even more complicated in that because this is activating your immune system, you can start to get problems in your immune system. So you can start to see aggravated problems like endometriosis, which we think of as a hormone problem, but it's actually an immune system problem that's aggravated by hormone cycles. Or insulin resistance becomes a problem. As I mentioned, cortisol helps to regulate blood sugar. So if your blood sugar is staying high all the time, you can start to have something called insulin resistance. And that's one of the causes of PCOS in like 70% of women who have it. So you can see that all these little kind of modern living factors start to affect our hormones. And, the cool thing, Lisa, is that as women, we're like the canary in the coal mine. Our hormones are the sensitive indicator that something is going wrong in the environment. And if we can catch these subtle symptoms early, like, really kind of like bothersome menstrual cramps, or getting headaches with every period, or having irregular periods, or a lot of sugar cravings, or any of the things that we tend to think of as like, well, that's probably just normal for women. If we can start to see those as a way that our body is talking to us and catch these early, then we can actually prevent a lot of later, bigger problems. The thing is, as women, we're taught to ignore our bodies and mistrust our bodies, and conventional medicine, with it telling us that our symptoms are in our head, just reinforces that. And, we're all trying to be great feminists and not admit that we're having period problems it's getting better. Women are talking about it more. But there have been a lot of reasons that we've come to mistrust those symptoms or just shut them up by suppressing them. So like I mentioned when we were first talking, 50% of women who are on birth control pills are on it not for contraception, but because they got put on it to control a symptom, often when they were in their teenage years. And then they're on it for sometimes 2 decades. I have women come to me all the time who have been on birth control pills for 20 years because they had irregular periods or acne or weight problems in their teenage years. So that is the kind of like big story on the adrenal and thyroid and hormone and all these other problem connections that we have.
Just a small issue that pervades through our entire culture, the way we live our lives.
Yeah.
Just this little thing.
Well, it's funny. The first time I was ever in a kidney surgery and I saw the adrenals, I had already been teaching about adaptogens for like a decade at that point as an herbalist. So I knew what the adrenals did. And I saw them and I remember saying out loud, oh my gosh, is that it? Like they're so small and they do so much.
Yeah. Well, so it's really complex because then we have this, even though I think there's a gradual shift towards understanding the role of food and diet, environment, and all those things, there's still this tendency to want a really easy fix. Everything that you described is complex. And the reason for that is because, I'm sure that we all know that there are a lot of different protocols, a lot of different herbs or nutrients that can support these processes. But ultimately, the picture that you just painted, that would work in conjunction with a bunch of other things. And so for the women listening, I guess one of the first questions about the adrenals would be, what are some of the signs and symptoms? I think we can appreciate some of them. But in terms of actually addressing it, what are some of the things that we can do in addition to, like, just instead of going for your favorite adaptogen to fix it all?
Yeah, so it's a complex system. And I think the beauty of our bodies is that our bodies want to move toward wellness. And so whenever we see symptoms, they're usually our body's way of trying to fix things or get toward wellness, or they are a reaction to a situation that's abnormal and our body's trying to compensate. And so even though a lot of complex things are happening that are really cool if you're like a nerdy science geek, like I clearly am, but the solutions are not that complex. And what's really amazing is that the solutions, because adrenal health and also thyroid health impact basically every aspect of your physiology, of the way your body works and your hormones, there are a few simple solutions that affect all the conditions and symptoms for the most part without having to go crazy with like all these different protocols. And it's sort of getting, in a way, it's getting simple and getting back to natural rhythms. That is the answer. So you asked about symptoms, and there are basically 2 big patterns of adrenal dysfunction that we see. I call them adrenal overdrive and adrenal with exhaustion. Now, adrenal overdrive is when you're in that stressed state. It's when you know you're stressed out. Like you hear women saying things, or we've probably said it ourselves too. I'm at the end of my rope. I'm exhausted. I'm burnt out. I'm crispy. I'm juggling too many balls. I have too many pots on the burner, on the stove. I can't take it anymore. Something's got to give. Something's got to break. Like the straw that broke the camel's back. We hear all these things. Those are all expressions that we're in overdrive. And the physical symptoms that tend to happen with it are a sense that we're stressed out, being driven by cravings, often for sugar or carbs or fatty foods. So we want energy, partly because the way the adrenals work and the way adrenaline and cortisol work, they're burning up those sources of fuel and we need to replace them. So you get salty foods are another one. So having sugar or other cravings is often a sign that your adrenals are in overdrive. Having sleep problems, especially being tired and wired, like where you just lay down and you cannot fall asleep, or maybe you're so zonked that you fall asleep, but you wake up a couple hours later, or you wake up really early and you can't get back to sleep, or you wake up and you're still tired. An afternoon slump, like where you're just needing a little sugar or you're jonesing for some coffee, is another sign. Those are anxiety is a sign. Worrying all the time, being super stressed out, like being driven to perfectionism it can be a problem that causes adrenal stuff, but it can also be a symptom of it. It's just that feeling like the other shoe is going to drop and you're always like jumpy and super sensitive to like overstimulation. Physical symptoms can vary, but anything with your thyroid, menstrual cycle, fertility, endometriosis, PCOS, not getting sick until you go on vacation and then totally breaking down, or kind of getting sick a lot. But getting sick a lot starts to get into more the adrenal exhaustion, so we'll get to that in a minute. High blood pressure, high cholesterol, blood sugar problems, insulin resistance, packing on weight, especially around your middle, that's a classic cortisol sign or insulin resistance sign. Those are a lot of the big ones that you see when your adrenals are overdriven. When your adrenals get overdriven for long enough, adrenal fatigue is not a real thing. Your adrenals don't actually get tired out, but your brain starts to recognize that if you stay in that hypervigilant state, if you stay in that overdrive, it's going to have a bad impact on your body, because what happens with your adrenals when they stay in overdrive, when you're producing too much cortisol and adrenaline, is you do start to get high blood pressure. You do start to get thyroid problems. You do start to get bone breakdown, muscle breakdown. You can get some pretty serious symptoms. And then your brain says, okay, well, we have to protect her from that. And so it tells your adrenals to stop producing so much cortisol and stop producing so much adrenaline. So now you're under supported by those. So you start to get a lot of signs of inflammation. Maybe you just start to develop some autoimmune disease, joint aches and pains, exhaustion, like deep exhaustion, depression. You can still have some anxiety. This is when you definitely start to see things like a thyroid problem, menstrual cycle problems. I'm trying to think of some of the other things. Those are the kind of big things that you see. Getting sick a lot and having a hard time fighting off illnesses, like you get every cold that goes around the office, or you get every cold that your kids get. Sometimes you'll start to have more outbreaks of things like herpes infection, or a dormant Epstein-Barr virus infection gets activated. So, there are a lot of across-the-board symptoms, and that's why I say so many different systems are impacted. But the resolution isn't necessarily that complicated. It is once you start to get other medical problems that come on board. So obviously, if you have insulin resistance or if you have PCOS, you want to look at some of the unique approaches for those. But to get your adrenals back on track, it really takes just a few things. And there are 3 key things that every one of us wants to think about in terms of what I call resetting our adrenals, so that that whole stress response system is calm. And you have to create a sense of safety in your life. That's the first thing. And the best way to create a sense of safety in your life, one, of course, is to get rid of any factors that are making you unsafe. If you've got a boss that's screaming at you all the time, or you're in a really abusive relationship, those are things that you have to take a deep look at and say, is this sustainable, and is my health worth it? I know it's not that easy to make those changes. Financial situations aren't so easy to change, but those can be big triggers. But how we respond to situations is also something that tells our internal framework, that amygdala, that, okay, maybe the world's a little scary right now, but I'm okay. And the best ways to get there are doing things like a daily meditation practice. It doesn't have to be where you sit on a meditation pillow for an hour. You can meditate for 15 minutes a day, 5 minutes in the morning and 10 minutes before bed. Journaling, just free-form journaling is great. The Artist's Way is a great book to learn about free-form journaling, and there are tons of journaling activities that you can learn about online. Yoga, or even any physical exercise that feels really good, but you have to be careful about over-exercising, because over-exercising can actually stress your body. So you want to find that sweet spot where exercise feels good and is relaxing but isn't overdriving you. So anything that gets you into that more calm, relaxed mode, and again, those sort of meditative art, anything that gets you in that zone is great. So that's one thing. The next thing is keeping your blood sugar balanced. A lot of women skip meals left and right, or, think that, having a juice at 11 o'clock in the morning is enough to get them through, or a smoothie at 11 in the morning is enough to get them through all day until dinner, and skip breakfast and skip lunch. What happens when you're in that low blood sugar state is that it sets off the alarm bells. It also tends to drive us to want to eat sugar and carbs to get that energy to our brain. And so you're getting a double whammy. You're getting all that insulin resistance, the inflammation, and you're getting low blood sugar. So keeping your blood sugar steady by not skipping meals, making all your food high quality. Like I always say, quality counts, not calories. And making sure that each meal has a good quality protein, a good quality fat. And there's something called carbohydrate cycling, which I won't get into now, but basically think about having at least one healthy, slow burn carbohydrate with dinner, like a whole grain or a sweet potato or some winter squash, something like that. That can really help with evening cortisol. And that brings me to the third thing, and maybe the most important thing, is sleep. And when our sleep is disrupted, it completely sets off the circadian rhythm. The circadian rhythm is like the conductor of your entire body. Pretty much every cell in your body, with very few exceptions, their music is what's being conducted by the circadian rhythm circuits, which are in your brain. And what's the sheet note? Like what's the musical notes that the conductor is using to communicate? Cortisol. So if your sleep rhythm is disrupted, then you can basically guarantee yourself that you're going to have adrenal problems. And we know from big studies that have been done, for example, women who work night shifts, like nurses, have much higher rates of hormonal problems, even breast cancer because of estrogen disruption, diabetes, depression, and heart disease. And it's because of that circadian rhythm disruption. We know that getting at least 7 hours sleep a night is critical for that, and even losing an hour of sleep a night can put you into this fight or flight mode that gets that stress response activated. Now, I get it that some listeners may work night shifts, and I know that some listeners will have little babies. There are things that I talk about in the book that acknowledge that in the Adrenal Thyroid Revolution, that you can do to try to offset. Babies, that's a temporary time in your life, and you have other hormones going on like oxytocin that help act as a buffer. But night shift nurses, night shift workers, midwives, whatever you are, an airplane pilot, you want to find ways to make your nighttime rhythm as closely matched to what a normal daytime rhythm would be, and be careful not to snack out on sugar and coffee overnight, things like that. But getting your sleep groove on is so important, and sleeping as much in harmony with waking up when the sun gets up and going to bed, backing that out by 7 or 8 hours. So if you're getting up at 6:30, you want to go to bed by 11 so that you get that 7.5 hours of sleep, for example. So if all you do are those three things, work on resetting your stress response by some self-care and meditation, yoga, hot baths, journaling, that good stuff that feels good to do. Do you have to do it every day? Ideally, 15 minutes a day is something for yourself, and definitely at least a couple of hours of set aside time each week to replenish yourself, blood sugar balance, and good sleep.
Mm-hmm. Amazing. Well, no, thank you for taking us through. It's just everything that you said. I was just sitting there. You could see me. I was just nodding and smiling because as complex as it is, you wrote an entire book on the complexity of our adrenal and thyroid systems. But it's not to say that it's easy. It's more difficult making all of these behavioral and lifestyle changes, because in my tool belt, I'm always looking at the menstrual cycle. If I'm ever working with a woman, we're always the chart is always front and center. And so in my work, it's sometimes a little bit easier because you have literally a printout in a sense of your hormones. And then if you start making some of these changes, as you're mentioning, getting enough sleep, focusing on finding ways to minimize stress and changing, getting rid of the boss that's yelling at you, things like that, you can actually see the shift in your cycles. So it can be very profound to feel like, wow, I actually can control my health to a much larger degree than I thought.
And it's like all stuff that's within reach, and it doesn't even have to cost much to do it. With the menstrual cycle, when your body is producing this sort of excess cortisol to keep you protected because it thinks there's some danger, one of the big things that happens is it starts to suppress the hypothalamus. And I know that you see and of course I do too, disruption in women's hypothalamus, that central gland that I mentioned earlier, like calling 911. It's not that the hypothalamus just triggers the adrenals, it triggers the thyroid and it triggers the ovaries. So all those, what we call axes are connected. And one of the best ways to help reset the hypothalamus, we don't have to get crazy with a lot of herbs and a lot of supplements. I mean, those can be helpful, but it is restoring that sense of calm, getting that, I always say it's like reconnecting the brain-ovary connection, and the brain-ovary connection gets interfered with by cortisol. It's like static on the channel.
Mm-hmm. Well, so one of the, I know that we won't have time to go into this in a lot of depth, but I would just love for you to talk a little bit about then the connection between adrenals and thyroid, because it's quite apparent that it's connected. For many women, by addressing the adrenals, their thyroid kind of goes back in balance. For other women, it's not, the same. Their thyroid requires its own situation. But I would so I'm not trying to simplify it, but there's obviously a connection.
No, you're not simplifying. It's a great explanation. Yeah, so there are quite a number of things that can affect the thyroid: environmental toxins, missing nutrients, infections. There are a lot of things, but one of the big things that can and does affect the thyroid is cortisol. So cortisol has 3 different ways that it impacts thyroid function. One is it tells the thyroid not to produce as much thyroid hormone. 2, it interferes with the production of active thyroid hormone. And 3, it tells the cells not to listen to thyroid hormone. So pretty much every way that the thyroid is supposed to communicate with your body, cortisol is telling it to not do that. And the reason is very elegant and very cool and very simple. Thyroid function is what drives your body's metabolism. It's like having the thermostat on, and you want the thermostat on high enough to warm your house up. The problem is that when you are in a crisis of any kind, your adrenals don't register what that crisis is. It just calls out the fire department, the police, and the ambulance all at once. It's like, I don't know what the danger is. Is it traffic? Is it her boss yelling at her? Or is there a famine? I don't know. And so it says, all right, well, there could be some kind of energy crisis. We can't heat her house up to keep her as warm as she wants to be. We need to turn down the dial on the thermostat because there's just not enough fuel to go around. And so in its attempt to protect you from overdrafting on low energy, it turns down the thermostat. That thermostat is your thyroid. So the adrenal is just trying to get you to conserve energy. Now, how do you conserve energy? Well, you make someone more tired so they're not running around and burning up a lot of energy. If you are worried about them burning up too much energy, it's definitely not a great time to be producing a baby because a baby's going to tap your energy. You need energy to grow the baby. In fact, your thyroid demands go up 50% when you're pregnant. You are going to, as I mentioned, store weight around your middle. So when one of the big symptoms that we see of women having a thyroid problem is they're suddenly gaining weight. Like they know they haven't changed their diet. They know they haven't changed their exercise. And all of a sudden they're like 5 pounds, then 15 pounds, then 30 pounds, and sometimes more. And sometimes it's in like 3 or 6 months, right? And so that's the way that the adrenals and the thyroid are trying to protect you. They're like, well, she might need extra energy, so let's store it. And so that's the connection. It's pretty cool.
Mm-hmm. Well, I love your analogies because it really paints a clear picture and it makes so much sense. And I think for a lot of women, when we're going through these challenges, it's like you have this thought of, I must be broken. There must be something wrong with me. But when you understand that your body is actually trying to protect you, then it doesn't make you feel better, but it kind of helps you to understand it a little bit better. You know, the reason that your ovulation was delayed, for example, is because your body was saying, this isn't a good time. And it's trying to prevent you from going into a condition that would cause more stress. And so,
exactly.
Yeah. And one of the things...
Yeah, even like when you're sick, even normally, let's say you get the flu, your thyroid function goes down because your body says, okay, well, we need to conserve energy because we don't know when she's going to eat because she's got the flu. And also we need to divert energy into healing and restoring, not this person running around doing all this other, daily life busy stuff. So it's a really normal response to any time your body's trying to conserve energy or protect you.
Mm-hmm. Well, and there was something in, there was one little, I saw this one, it was like this cute little green box, and it was talking about the pill and the effect on thyroid. And the way you described the relationship between, I think it was cortisol, sex hormone binding globulin, correct me if I'm wrong, but maybe share with us, because I thought that was really interesting, because we've heard a lot that the pill does impair thyroid function, but in your description, that one little, I mean, I'm sure there's more to it, but I just remember that one little box that I was reading, and I was like, oh, this is so clear. I totally get it now.
Yeah, so there's a lot of controversy, and still like the jury's out on exactly how much the pill suppresses thyroid function, but it definitely causes dysregulation in blood sugar, and it changes the amount of sex hormone binding globulin you have. And so you might be binding more of your thyroid hormone. Sex hormone binding globulin is like an Uber going around in your body, picking up passengers. The passengers can't do anything on the sidewalk because they're in the Uber. So it's like if the hormones are out and free and circulating, they can walk around, they can go into a shop, they can do stuff. But if they're in the Uber, they can't do anything. So think about sex hormone binding globulin as just binding. That's what it does. And if that's elevated, it can bind to thyroid hormone. And so you're not getting as much activity from your thyroid hormone, even though you're producing it, which is interesting because then it looks like you're producing enough and your doctor might say, oh, no, your thyroid's fine, but they're not checking all these other things.
Mm-hmm. That's just so interesting to me because, hormonal birth control significantly increases sex hormone binding globulin. And the focus when I've been researching is the effect on testosterone and how that can impair libido. And so to think about the impact that it could have on thyroid hormone as well and how that could be part of the reason to suppress it, making less of the hormone available. I just thought that was a really interesting, important tidbit to throw in. But you know what? I know we could talk all day because I still have like a list of 27 billion questions, but well,
you can ask me a few more if you'd like to. I don't mind.
All right. Well, let's talk a little bit about, I'm looking at these two different questions and trying to think of which way I'd want to go. But you mentioned, I think one of the bigger topics about thyroid, especially related to women who are trying to conceive and women who are becoming pregnant, one of the things that you mentioned is that as soon as a woman becomes pregnant, her requirement for thyroid hormone increases 50%. And I think many of us know that during pregnancy and postpartum is basically the time, if a woman's going to have a thyroid issue, the chances of that are so much higher at that critical point in our lives. Huge topic, but maybe you could just shed a little bit of light on that, as many of the listeners might be in that space of either actively trying to conceive or planning for it in the future, or even pregnant and trying to kind of figure out how to navigate this. Yeah.
So if you already know that you have hypothyroidism, when you get pregnant, and if you're on medication, you want to, of course, work with your midwife or provider, but typically you increase your thyroid medication by 30 to 50%. And the reason is that the baby's growing his or her body, basically you're growing the baby's body. So not only do you have to do all the metabolism for yourself, you have to break down all those nutrients to keep your own cells and tissues healthy, you need to break down enough nutrients to grow an entire human being. So that requires a lot more energy. And so that energy demand goes up. But even if you don't know you have a thyroid problem, in my preconception and fertility patients, every one of them gets a thyroid panel. And I'm not someone who does a ton of medical testing. I think there's a lot of over testing going on in functional medicine. But we know that optimizing your thyroid, particularly that TSH and T4 at healthy levels, really increases your chance of getting pregnant and also staying pregnant and having a healthy baby. And healthy thyroid in pregnancy means you're much less likely to have postpartum depression or postpartum thyroid problems. And so the consequences of low thyroid, you know, like we talked about, you might not ovulate, you might have a harder time getting pregnant. You are more likely to miscarry if you have a thyroid problem. A lot of women go through miscarriages and nobody checks their thyroid. I've had so many women who have come to my practice who have had 2 or 3 miscarriages and they have no idea why. And then you check their thyroid and they had hypothyroidism. And that, all of that maybe could have been prevented with thyroid treatment. We know that women going through IVF and other, an IUI of any assisted reproductive technologies, those reproductive endocrinologists want your thyroid hormone levels to be much more optimized. Like they want that TSH to be like 1.5 or 2, which is less than half of what doctors usually consider to be normal. But you know, pregnant women who aren't going through fertility treatments never get told any of that. So I like to optimize closer to that ideal fertility treatment range. Then during pregnancy, you're much more likely, like I said, to have miscarriage, but also to develop gestational diabetes, preterm labor, a whole host of pregnancy problems. And a healthy thyroid is critical for baby's brain and thyroid development too. And then postpartum, one of the big unknown or one of the big undetected causes of postpartum depression is hypothyroidism, which could easily be detected and treated. So super, super important to get just a basic thyroid panel if you're planning to conceive, and make sure that your thyroid's getting checked during pregnancy appropriately. And then if you are having trouble producing breast milk, that's another sign of low thyroid function, or having postpartum depression, definitely get your thyroid checked. And I have 2 podcasts and blogs on that over at my website for folks who want to know more about that.
Well, we'll make sure to link those. As you're talking about these things, and I know every time I say that to somebody or mention that to a client, that, well, immediately upon becoming pregnant, the thyroid range changes, and how much more thyroid hormone is required to sustain pregnancy. It just makes you wonder, why isn't this just the standard testing? Why isn't this just how, given the fallout of having subpar thyroid function for fertility and pregnancy is so great that everyone should be on top of this.
There's a known controversy, well, known to me because I researched this stuff, but there's a pretty well-documented controversy between 2 of the major medical organizations. One is ACOG, which is the Obstetrics and Gynecology Organization, and one is the Endocrinology Organization, which are the ones that specialize in thyroid function, amongst other endocrine glands. And the Endocrine Society feels that all women who are pregnant or preconception should be tested, whereas the obstetrics and gynecology, for whatever reason, hasn't adopted that as a standard. So apparently up to 60% of women who have a thyroid problem are missed during pregnancy or postpartum because it's not being standardly checked.
Yeah, it's just, the word that came to mind was criminal, but that's probably too strong. But I don't think it's really.
Unfortunate. Again, it's looking at the wrong information. So, in a nutshell, there are 2 competing standards for thyroid testing. One standard, the one that most doctors use, is based on doing blood samples on a random sample of Americans. So, let me give you a comparison. If you went to a concert and there was a random sampling of Americans, and we know that 30 or more % of Americans are obese, you would think that normal weight includes obese people, right? Like that would just be what's considered normal. The other set of guidelines looked at, and that wasn't meant to dig on anybody's weight, just so you know, I'm just trying to give an example. It could be headaches. It could be a random sample of people with headaches. And at that time, you don't take out people with headaches. You just say, okay, well, that's part of normal. The other group is based on people who don't have any thyroid symptoms. So the first group, they just took all comers, took blood samples, didn't exclude for people who may be having thyroid symptoms, and said, okay, the average normal is this. The other group excluded people with thyroid symptoms, looked at only quote unquote healthy non-thyroid people, and then got a completely different range. So that would be like going to a marathon and assessing everyone's weight. It probably would be closer to a leaner range than more people with higher BMI. Make sense?
Yeah, no, totally does. And
so the wrong standard is being used. It's like an average standard that includes people with the problem.
Mm-hmm. Well, and then you could go so further to say that there would be an optimal standard for fertility and pregnancy. But then there's there's always a part of me that says, but if I'm not trying to get pregnant, don't I deserve to be healthy also? But I suppose that's another question or another comment.
Yeah, I mean, it's interesting because there's also it's different racially. Like we talk about a healthy vaginal microbiome, but we know that when we look at different samples, Asian women versus African American women and Latino women versus white women, you get different vaginal flora. Similarly, we actually see different standards. So in a healthy African American population, the thyroid numbers are even a little bit tighter. So one then has to say, okay, well, should we be, not to racialize people, but if we know that one group of people actually needs an even more optimal range, are we not treating people appropriately to what that range should be? And just sort of normalizing everyone into sort of like one average, more likely white standard.
Mm-hmm. Yeah. Well, and not to mention that so much of the research is done on men. That's its own kettle of fish. Well, I feel like we've gone through so much. I've just loved this conversation. And I loved also that at the end of the book, it was just a really nice way to close it out and to really give some guidance as to how to choose a practitioner. And so I really appreciated that section because the way you talked about it was just very rational, very specific, acknowledging all the different roles of different care providers, encouraging women to really be their own advocates. And so, I mean, if there's one thing that you want the listeners to take from our conversation today, what would it be?
I would say to trust your body. If you trust yourself, not just your body, but trust your whole self. And if you feel that something is different than it was before, you have new symptoms, or you just know something's up and you're not being heard, find a way to be heard, whether that is organizing your thoughts, looking at how to choose a practitioner, which I talk about on my website too. You can find that information for free. Bringing an advocate with you, if that helps, bring a trusted friend, or firing your doctor and finding another doctor. But if you truly feel like something's up, don't be convinced that you don't know your body best. I tell my patients, I may know anatomy better than you. I may know physiology better than you. I may have studied this stuff for 30 years, but you know you better than you, and you've been studying you your whole life. So trust that.
Mm-hmm. Love that. Couldn't have thought of better words to end on. Dr. Aviva Romm, this has been amazing. Thank you so much for coming on the show.
Thank you for having me. It's a pleasure. I love your questions too.
Oh, thank you.
Your energy.
Well, thank you. I'm super keen, obviously. And as I mentioned before, really loved your book. I think it's such an amazing and important resource for women who do struggle with questions about what to do about adrenals and thyroids. So this resource is going on my list. And my clients that struggle with these challenges will be getting recommendations regularly. But where can our listeners go to find out more about you, buy your book, and and also you have a series of online programs. Maybe you could tell us a little bit about those.
I do. So you can find me at my website, avivaromm.com. And if you want to get the book through my website, we have a bunch of bonuses, which is fun. So you just go to avivaromm.com/books or book bonus. Sorry, avivaromm.com/book bonus. And that'll take you to a page. But even if you just already got it on Amazon, you can go to that page and kind of put in some information, and we'll get you all the cool bonuses too. And then I have a podcast, which is Natural MD Radio. I hang out over on Instagram a little bit too. Just look for my name. And so I have some courses. I have a gut reset. Which comes out just it's a one time a year or 2 times a year, so it's not evergreen, it's not all the time. An adrenal course. And then for women who are practitioners or interested in herbal medicine, I have an herbal medicine course, and I have a professional, functional, and integrated medicine course as well.
Wonderful. Well, thank you again for coming on the show. This was a really great conversation. I know that the listeners are going to love it.
Yay, thank you for having me.
Thank you for listening. If you enjoyed today's show, please share it with a friend. You'll find the show notes page for today's episode over at fertilityfriday.com/259. I hope that you enjoyed my interview today with Dr. Aviva Romm. It was such a treat to have her on the show and to really jump into not only adrenal function and thyroid function, but also to get a window into medicine and what her experience was like in medical school. And as I mentioned at the beginning of the interview, I had an opportunity to read the Adrenal Thyroid Revolution before our episode today. Whenever I get a chance to do that, I like to do it because it gives me a good background, helps me to formulate questions, all those types of things. But when I was reviewing the book, it stood out to me that she did talk about her experience in medical school, specifically how, I suppose you could say that as her experience in medical school differed from her experience as an actual doctor. So she was having women come into her office with specific issues that she realized weren't really addressed adequately in her medical training. And so I think that having that understanding of how doctors are trained, what their paradigm is, what types of treatments they have to offer, and also I feel like it helps us to empathize with our doctors so that we have an understanding of where they're coming from. But I feel like it also allows us to be more realistic in terms of our expectations of our doctors. When you understand that doctors are not specialized in functional medicine, traditional doctors who didn't specialize in functional medicine, and also are not specialized in nutrition, because that's, medical school doesn't have a large focus on nutrition. I think that helps us to adjust our expectations and to really get a sense of how our care practitioners can support us. And if you are really wanting someone to be supporting you in a different way, so if you're looking for a practitioner who is going to really look at the root cause and try to help you figure out what's going on and support your body through a combination of dietary and lifestyle factors, I feel like it's helpful to recognize where you can get care like that and where you cannot. And to really, it's what I always talk about, having that boardroom. I always call it the boardroom analogy, but basically we're at the point in healthcare, especially as women, when you're facing specific health challenges regarding your fertility, regarding your hormones, regarding your menstrual cycle. We need a boardroom. We can't just give our care up to one practitioner. And so having your doctor understanding what role your doctor is going to play, but recognizing that if you're wanting to address it in a way that looks at the underlying root cause and tries to heal and restore natural, healthy bodily function, then you may need more than just your doctor. And in most cases, you will. And so I think that's really, really helpful. So I really appreciated that insight into what it's like in medical school. And I also really appreciated how Dr. Romm took us through the adrenals, and just to illustrate stress and the different types of stress and how that plays out in terms of our hormones and in our bodies, and really highlighting the importance of looking at our lifestyle factors, at our dietary factors, at our sleep patterns as a way to make a huge impact and restore our normal rhythms, our normal circadian rhythms, our normal hormone production. Because I think in this day and age, we're always looking for an easy fix. We just want, the medication, the drug, the herb, the vitamin that's going to make everything better. Because it's a lot easier to pop a pill every day than it is to change your work situation, or to adjust your sleep habits, or to adjust your dietary patterns and things like that. So really, really powerful interview with Dr. Romm today. And I'm really glad that we were able to really dive into adrenals, how they relate to thyroid function, and just leave with some really practical ways to improve our health and our hormone balance overall. So I just want to thank you for spending some time with me today, for hanging out with me, listening to this episode. And as I always say, I really appreciate all of you for supporting the Fertility Friday community, for spreading the word about Fertility Friday, fertility awareness, body literacy, and essentially just joining the movement of female health empowerment. I mean, that's really what this is about. And, if this episode really struck you, or somebody who you feel could really benefit from listening to today's episode, somebody who could really use the information that we shared today, then please do share this information. The sharing link for today's episode is fertilityfriday.com/259. And, like I said, at the beginning of the episode, this was a really powerful interview for me. I really loved where the conversation went, and I felt like it was a really interesting and deep insight into the disconnect, the reason why so many of us are unsatisfied with the care that we receive in our doctor's offices, the reason why, we're wanting more. And many of us have that intuitive sense that, no, there has to be another way. There has to be more to this. This couldn't be my only option. And the more that I have an opportunity to interview medical doctors and really dive into, what is medical school like? How are you trained, and what are some of the challenges that you faced? It really helps for all of us to understand how modern medicine can help us, and also, how we can all benefit from an integrative approach, and why we need that team, especially when it comes to female health, female fertility, fertility challenges in particular, menstrual cycle health, just generally women's health issues related to reproductive function, hormonal balance, and all of those types of things. It really helps us to understand why we can benefit from a team approach. So with that said, thank you again for spending some time with me today. And just a quick reminder that the audiobook version of The Fifth Vital Sign is now available, and you can purchase it through Audible on Amazon.com, and it's also available in iBooks, so you can actually purchase it either way. If you have never used Audible before and you're thinking about creating a subscription, you can actually listen to The Fifth Vital Sign for free when you sign up for a 30-day trial with Audible. So make sure to head over to fertilityfriday.com/audible for details for how to set that up. So that's fertilityfriday.com/audible. And with that said, I will leave you to enjoy the rest of your day. Thank you again for spending some time with me. And of course, as always, until next time, be well and happy charting.